All right, I think we're ready to get started. So, hello and welcome. My name is Farrell Kuritzis, and I'm the director of the Center for Arts and Medicine at the University of Florida. We are delighted to have you join us today for the second webinar in our Arts and Health webinar series. Today's webinar, Arts in the Clinical Setting, Exploring Models, Applications, and Career Pathways, will focus on the role of the arts within healthcare and clinical settings by sharing models of practice, career pathways, an overview of the field of arts and health, specifically within clinical settings, and practical insights into how artists can thrive in healthcare environments. Arts and health is truly interdisciplinary. Those working in the field have a wide range of educational backgrounds and experiences, and there are so many entry points and paths to becoming involved with arts and health. This webinar series is designed to illuminate all the possibilities. In future webinars, we will continue to explore specific areas of arts and health more deeply. So sign up for our Arts and Health Today newsletter to find out about the next webinar and the latest news, research, and opportunities in the field of arts and health. So before we hear from our panelists, here are a few important reminders. Live captioning is available. If you'd like to use closed captions, hover over the More button on the bottom of your Zoom screen and enable captions. Today's webinar is being recorded, and the resources mentioned during the webinar will be emailed to all registrants. Please feel free to use the chat to comment and share ideas and relevant resources. And if you have questions for the panelists, please use the Zoom Q&A feature, and they will get to as many questions as they can during the Q&A portion of the webinar. Now, I'd like to introduce you to our webinar moderator, Natalie Rella, to kick off today's webinar.
Hello, everyone. Very excited to have you all here. My name is Natalie Rella, and I am truly excited to have this group of people exploring a very specific part of the arts and health field. But in our last webinar, we introduced the broader landscape of arts and health. So if you missed that, you can find the full recording on our YouTube channel. But today we are zooming in on a key area in the field, arts and health in the clinical setting. And this area is particularly near and dear to my heart because it was my first foray into the field of arts and health many years ago, and in fact at the UF Health Shands Arts and Medicine program. So I'm excited. It's a meaningful topic for me. And to help us dig into this topic, I've invited three incredible thinkers and activators who continue to shape this work every day in a clinical setting, and they will lead us through a thought-provoking conversation about what practice looks like, why it matters in a hospital or clinical setting, and the diverse career paths within it. So without further ado, I'm going to introduce the panelists. We have Dr. Jenny Baxley Lee. Jenny is the director of UF Health Shands Arts and Medicine, the program at UF Health Shands here in Gainesville, Florida, and also is a master lecturer at the University of Florida Center for Arts and Medicine, where she actually co-founded the Arts and Medicine program, the curriculum at the College of the Arts. She's also a board-certified dance and movement therapist and has 22 years of professional experience in arts engagement with children and adults in the clinical as well as the community setting. So bringing lots of important insights to this conversation. We have Elke Downer, who's the senior manager at JoyRx Music and also a Center for Arts and Medicine alumni. In her role at JoyRx, she oversees a national team of music specialists and manages a portfolio of more than 30 pediatric hospitals and healthcare organizations to bring the healing power of music to children across the country. She's also a multi-instrumentalist and vocalist and holds an MA, as I said, from the UF Center for Arts and Medicine. Another great person to have in the conversation. And finally, last but certainly not least, Ricky Kendall, who is an arts and health practitioner at UF Health Shands Arts and Medicine. He's been working as a Gainesville-based musician for 25 years. He uses music and visual art to facilitate creative connection both in the hospital and out in the community. And his personal art practice has deepened in a way that he also loves and is interested in holding artful spaces for others to find their own creative paths. Ricky, how long have you been with UF Health Shands?
I think 12 and a half or 13 years, something like that.
Bring in the
Yeah.
solid game. Again, another incredible voice in this conversation. So we are going to get moving. I'm gonna go, the format will be conversation. So I'm gonna ask questions, they're gonna give responses. You guys are welcome to comment in the chat, please do. We also, if you have questions, as Farrell mentioned, please drop them in the Q&A function that you can find at the bottom of your screen. And you can also like thumbs up the ones that you liked so that we can prioritize the questions at the end. We're going to try to get through these questions so that we have time for you all to get your questions answered as well. As was mentioned, this is being recorded. A recording will be shared. All the resources mentioned, plus more, will be shared with all registrants following this webinar. And if you have resources to share, please drop them in the chat. I will populate those into the shared document following the webinar. If you have wisdom and insights to share, please drop them in the chat. I'm excited to get this started, shall we? Let's do it. Okay, let's start. An opening question. Can you each share how you came to this work and sort of what drew you to the practice of arts and health specifically in the community or in the clinical setting? And I'll start with Dr. Lee.
Let's do this. I am so delighted to be here. Thank you for the invitation. I see so many familiar names, so shout out to everybody who joined the webinar. What drew me to the work when I was about 14, my Aunt Lavon was a director of activities in older adult care. And I began singing at the bedside with patients to volunteer my time after high school. It's one of the most meaningful experiences of my life and just felt like compelling, beautiful, and deep exchange. So as I began moving into college, I was looking at that intersection of how we could use the arts to promote health, well-being, despite maybe chronic conditions, diagnoses, and at any stage of life, from birth to dying experiences. Discovered that I really loved to dance. So as Natalie mentioned, I studied dance movement therapy, and I did that by way of human development and family studies. I became a child life specialist, always working with folks who are nearing end of life and or had very significant chronic health conditions. So that was my kind of foray or entry into the work.
Great. Let's move on to Ricky.
Hi, everyone. It's such a pleasure to be here with you all. I also see a bunch of names I'm familiar with in the chat. Good to see you guys. My foray into the work, to be honest, was quite accidental at first. I was asked by a friend who was doing the work, Danielle DeCosmo, with the Arts and Medicine program, to see if I wanted to volunteer and lend my musical skill to something at the bedside. And I decided to do it. In the meantime, I was kind of pursuing a music career of sorts, and it was an early stage of that, so I wasn't quite there yet, but I was working on it. I was touring and playing around town, and when I volunteered with her for several months, and I really enjoyed the work. I enjoyed peeking behind the veil of the work and getting kind of a really masterful person to lead and guide me in the work, which I think is also very important. I'll probably revisit that a little bit. And it provided me a kind way to enter that hospital biome. And I learned so much about people in this work. And just those first few months, I was kind of I got super excited about the possibility of doing that more. And then she moved and she asked if I wanted to put my name, my hat in the ring for a position, and I did, and that's how I started the work. And I've fallen deeper and deeper in love with it every day.
Lovely. Elke, how about you?
Excellent. Thank you so much. It is such an honor to be here. I'm just, so honored to be a part of this panel with these incredible people. So I also came into the field somewhat accidentally, I suppose you could say about 9 years ago. So as Natalie already shared in my introduction, I'm a musician. So my background has always been in music performance. I'm a folk singer, songwriter, and a guitarist. So I've always done a lot of performing, went to school for music. But then simultaneously, I've always really loved working with kids. And through music, I've done a lot of music education, particularly within early childhood development centers. So really just love doing music with children. And then so I'm based in Portland, Oregon, and there's a nonprofit organization called the Children's Cancer Association. And it was about 9 years ago that I learned a little bit more about the work they were doing. And their flagship program is called JoyRx Music, where they bring bedside music into the pediatric hospitals here in Portland. So I just kind of thought, with my background in music, the music education I've done with early childhood development, like maybe this is something I'd like to explore. So I applied for the position and became the JoyRx Music in-hospital supervisor, and that was really my introduction into music in the clinical setting. So I learned a lot through sort of the in-house training with JoyRx Music, and just really fell in love with the work, like being able to work with children in that capacity through music at bedside in the pediatric healthcare setting was just so special and meaningful. I just really felt like I found my calling. And then since then, my position has just kind of continued to grow and expand within the organization. And so while I'm in the clinical setting, I'm kind of also representing sort of the nonprofit sector today because I'm affiliated in a few different ways with Children's Cancer Association, Swan Songs Portland, where I'm a board member. And then also I do a lot of work with NOAA, where I co-chair the Artist Workforce Development Committee. And then of course, a UFCAM alum. So just very, very happy that I found this field.
Awesome. All right, well, let's jump into some questions. So the first one is going to be sort of patient-centered. What kind of patient outcomes or feedback have you gotten that have most powerfully demonstrated the impact of the arts in the clinical environment? Anyone can jump in at any time.
I can,
Sure, I'd be
go
happy
ahead.
Okay, should I start? Okay.
Go for it.
Perfect.
Go for it.
Absolutely. No, I really enjoyed this question when it was passed along as well too. And I was like, oh, this is where research and data is so fun to pull on too. So with the JoyRx Music program, we have an impact assessment tool that we utilize for our JoyRx Music sessions that really focus on psychosocial wellness domains. So of course, we're not doing clinical interventions in the sense of, we're not working on those clinical outcomes that say music therapy would. So we found that psychosocial wellness domains was really helpful to look at when designing our impact assessment tool. So we kind of broke it down into 3 sections where we look at the child, who is the participant that we work with in the hospital, as well as the caregiver. So that could be a parent or just any family member that might be there with the child, and then also healthcare staff, because we work with them a lot through our sessions. So for the child participants, we're really looking at engagement, empowerment, social connection. And then for the caregiver, we're looking at relief and enjoyment and empowerment. And then for hospital staff, we look at perceived support, environmental impact, and emotional state. So this assessment tool allows us to collect both quantitative and qualitative feedback from the participants and family members and facilitators. And so some of the feedback that I've just really found to be the most powerful is that parents and caregivers universally find it helpful for their child to connect with someone who isn't a medical professional. And I find that to be just a very powerful statistic because, again, we know through a lot of research that the hospital environment can be very challenging for children. There's a lot of isolation and loneliness, and they lose a lot of autonomy. So to kind of have that connection through music has been very powerful. We've also seen feedback that overwhelmingly a majority of kids report enjoying the music session. So just kind of that focus on enjoyment and distraction for something else. And then also hospital facilitators have overwhelmingly reported a positive change in kids during the music session. So it's really nice that we're able to pull this data and see the impact that is happening through the programming.
That is awesome. I love to hear that direct data coming through. Ricky, you had something to share.
Yeah, that was beautiful, Elke. Thank you. I can echo a lot of what she's saying. I'm a little less on the research side. I'm kind of feel very boots on the ground in the room at the bedsides. And but what I see as a trend that's developed is the buy-in from the hospital institution when they see the positive impacts that we have on their staff and on their patients. And that causes us to reach out further into the community, because you see people leaving this hospital with an arts practice that they didn't have when they got here. And I don't know if how many of you have had hospital experiences, but that's the last thing you expect to walk away from a hospital with. And when you have that, and I'll probably say this again in a little bit, but it really reframes the story of your clinical experience. It reframes the story of your illness. It reframes your relation to that dynamic, whether it be with your body, your mental health, and as we all know, the clinical setting can be very difficult for all those things. So when we see someone that never played guitar in their life, never saw live music in their life, have a live musician come to their bedside and wow them with their preferential music, and then they get the idea that maybe I could play guitar one day, and then maybe that's an ongoing thing that helps them not only in their recovery, but in their well moments that are going to follow this. And I think that's a beautiful thing.
I can hop in and just add, much like Elke at U of Health Shands Arts and Medicine, we're documenting both meaningful and challenging aspects of practice among our artists, and also kind of looking at healthcare workers' experiences, both their preferences in arts activities, but also impacts to well-being and staff retention as well, which is something the institution is always keeping an eye on. So always thinking across the audiences we're trying to reach. And for us, that's not only patients and families in the clinical setting, but also our healthcare workers, like Elke mentioned, and our leadership team for the buy-in that Ricky mentioned. So those are a couple of layers I'm always thinking across. And in the field more broadly, I think some really exciting things are happening in social prescribing and arts prescribing that we're working toward as well in a pilot program, and are conducting some research looking at arts prescribing and youth mental health promotion, as well as with sickle cell populations and folks with movement disorders.
Awesome. And a good segue to the next question, Jenny, which is, beyond the patients, have you seen the effects of the arts and arts engagement on healthcare staff, especially in terms of resilience, morale, burnout, and maybe point to some direct practices that you guys have explored or engaged in?
Yeah, really good questions. I mean, we have annual practices like our, National Nurses Week, where we engage nurses both in visual art, but also with music for more passive and receptive engagement. So music in our atrium or public spaces as well. So as many kinds of arts participation as is possible to provide without disrupting patient care, so that our healthcare teams are really getting that kind of breadth of potential participation, be it active or receptive. So that's the way we kind of practice. We're just discovering, more and more, and I hope you all on the call are seeing some of this research coming out, that arts participation is a health behavior. There's some groundbreaking research coming out of the Epi Arts Lab at the Center for Arts and Medicine in partnership with UCL and Dr. Daisy Fancourt's lab. So keep your eye out, because they are really breaking through in this space.
I can jump in to add something here as well too, because sort of speaking from the perspective of with our JoyRx music program, it really is pediatric patient facing. So it's not specifically designed as like a facilitated experience for the healthcare workers. However, the healthcare workers are in so many of the sessions that we do. So we will have healthcare workers, child life specialists. Shout out to any child life specialists here. Jenny, I didn't even know that you had a background in child life too, but we love our child life specialists. So we work very closely with child life to help facilitate our sessions, both in person and virtually. So naturally, they're going to experience some of the music. We also work with a lot of CCTV broadcast studio hosts for some live streaming that we do in pediatric healthcare facilities. And then, of course, just nurses and administrators who are going to experience the music programming in action. So we do send out an annual partner survey to more than 50 pediatric healthcare sites that we work with across the country. And so we do focus a section of feedback on that healthcare partner experience. So Some of the responses that come back that I find very interesting are around enhancing the healthcare environment and improving mood at work, specifically for the healthcare staff. And those results have been overwhelmingly positive each year that we've delivered the survey. So it's nice to see that even though our music sessions aren't designed specifically for the healthcare staff, that they are benefiting from the music being in the pediatric space.
And I love this, and I imagine that administrators and leadership decision makers within the hospital who are seeing in real life the impact that it's having will be swayed, and the buy-in will sort of organically appear. Ricky, did you want to add anything?
Yeah, I can add one more thing to that.
Please.
This is a good example of the adaptive nature in which we work. During the pandemic, we were trying to figure out a way to get back in touch with the dwindling healthcare staff, the massive turnover that was happening. To boost morale, to get them connected, and we were the ones to do it. We were trying to figure out a way. So we tapped into a local radio station run by a friend of the community, and we decided to put on an hour-long requests radio station, song request radio station for the staff in healthcare at UF Health. And we basically would approach the charge nurse station and say, is there any songs you'd like to send out to anyone today that you're thinking about, a coworker on the night shift or on the day shift? Is there anyone you think could use a song to start off their week? And that's how it kind of started, and it's turned into an hour-long radio segment that airs twice on Wednesday, every Wednesday, and it's filled with interviews based on arts and health. And it could be practitioners, it could be people in the community. We feature many of our patients on this radio station. So that's one way we've really kind of delved into the idea of like, how can we kind of improvisationally provide programming that could include everyone and kind of anything relating to arts and health. And it turns out there's a large audience for that here in Gainesville, Florida, and I think everywhere. So it's available online as well. So you can put that in the chat as well.
Awesome. Thank you. All right, I want to move us into sort of models of arts and health practice in hospital settings. So can you share an effective model or structure that you've used or seen that has integrated the arts into clinical care? Maybe it's a program or partnerships or roles that have been created within the hospital. You guys decide what you want to bring forward, but I want to make sure that folks on this webinar hear from you some of the effective models that you have seen or used.
I can hop in here briefly and just describe the model we're currently using at UF Health Shands Arts and Medicine, because it has had an evolution over its 35-year history. This is our 35th anniversary, and I've had the pleasure of directing the program just the last 3.5 years. So massive shout out to the founders of this program. I stand on the tallest shoulders in the world and feel really, really grateful to each and every one of them. But just can share that we began with a model where artists were volunteering, and that did not last long, but it was the inception, and we were serving mostly healthcare workers. So we were doing workshops, arts workshops for caregivers. Many of you may know Dr. John Graham Pohl, who was one of the founders. He was a pediatric palliative care physician, and he called them play shops and really centered laughter and play for healthcare workers as part of the kind of beginnings of our program. And pretty quickly we moved to a 1099 model, meaning that the artists that came into the program were on contracts, 1099 contracts. And that lasted for nearly 3 decades. This program did move from being housed in many different departments, from volunteers to public relations, PR, and then became eventually a department of its own. John recently shared with me that the department began with $50,000 from Shands. And this would have been around maybe 90, 91, 92 in those years. So that was pretty exciting to get a budget from within a hospital as a model. That was pretty groundbreaking in its time. At this stage, about 3 years ago, we successfully advocated for artists to be able to move from 1099s to W-2s, meaning they became employees of UF Health Shands. And that was really exciting for a number of reasons, but the primary reasons were things like FICA match. We were being asked by artists to have that tax match from the institution, but also healthcare benefits. Our artists worked at the bedside and were considered essential workers at UF Health Shands without healthcare benefits, or even early on, access to vaccines. And all of that did change. This team, the amazing AIM staff, administrative staff, and artists were able to advocate for that care over time. But initially, they were deemed essential workers, but without the kind of resources that UF Health Shands now is able to provide through employment status. And we did try to go about that by inviting artists to reflect on their preference between being 1099 or W-2 and still maintaining choice for artists, and also mostly maintaining half timelines, so between 20 and 32 hours, which is considered full-time here at Shands. It comes with full-time benefits, but does not require that the artist lay down their own professional practice outside of these walls, which Tina Mullen, one of the founding directors, felt was paramount to artist well-being and being excellent and proficient in their craft and their art form.
That's amazing, Jenny. That's really cool to hear, just the evolution of the program. I didn't know a lot of that, so that was really fascinating. I'm happy to jump into with just some perspective from, again, kind of that nonprofit background. So again, with the JoyRx music program, we work in all these healthcare facilities across the country, but we're not employed by the healthcare institutions. So we're a nonprofit, and so we have a team of music specialists. We have actually 10 of them across the country, and they're also full-time employees. So they work full-time with benefits. So this allows for us to do a lot of our training and professional development in-house, making sure that we have those sort of quality standards, benchmarks for the program across the board, since we're operating nationally in different healthcare institutions. We do also have a volunteer model, though. And so there's a little bit of a different scope of practice. Our volunteers don't go bedside to do music directly with patients in their room, but our volunteers will provide amazing music in hospital lobbies or hallways to kind of really bring that sort of ambience and environmental music into the healthcare setting. But they come in as volunteers, whereas our music specialists are full-time staff. But another thing that I think is kind of neat about the evolution of our program model is that we've always had our in-person music, so bedside with specialists, and then the volunteers doing environmental music. But I think it was Ricky that already brought up the pandemic, so I do have to kind of go back, because we can't ignore how the pandemic changed so much for arts and health in the clinical setting. So we really had to make some changes during the pandemic, because we are not essential healthcare providers in any of the sites that we're in. So we couldn't be physically bedside in any of our sites anymore. So we ended up developing a new branch of the JoyRx music program called Digital Live, which allowed us to provide our music virtually through Zoom sessions with iPads, and then also live stream concerts through CCTV. And this program continues to flourish, which I think has been a really cool part of it. We originally thought it might be somewhat of a COVID Band-Aid, but it now provides music for more than 30 of our healthcare sites across the country. So I think we found a lot of success in this sort of hybrid model, like having our in-person program, but also being able to provide things virtually, which just allows for a lot of accessibility and kind of breaks down some of those geographic barriers. So now we have that hybrid model with live music in Portland, Austin, and New York, and then virtual music serving the rest of our sites.
That's amazing, Elke. Yeah, that's so cool that it kept going like that. We did a few of those Band-Aid things too, and some of them, like shift change, lasted, but then we got back in house and we kind of fell back on that human connection, that real time. But I'd love to talk to you more about that, actually. I'm curious. One other thing I wanted to bring up was volunteers and being, I guess, practicum students from the academic side, from the Center for the Arts and Medicine. I shadow probably, I don't know, 6 or 7 students every semester, multiple times. And this really is a cool connection point for me because part of that model reminds me of how important it was. Like I said in the beginning, it was for me to see that real life in the room dynamic with an artist and a patient or a staff member. It's something that they can observe and they can ask me any question they want afterwards. We can email back and forth afterwards. And it's always a super inspiring thing to see like this next generation of students coming in to maybe a medical practice with that bent of arts and health. And then we can say, you know, here's why this is beneficial. Here's how you can actually use it in your practice, even if you're pursuing a medical degree. And I think it gives, makes way for the future medical practitioners to have a really good idea of how to invite the arts into those situations because as we know, the staff members at our hospital are the biggest champions of our work, and without them, we don't get in those rooms. So that's also a pretty big piece for us.
I love that. Another great segue to the next question. So can you talk about or share strategies, partnerships, or approaches you've found to be most effective for growing arts and health programs in a hospital setting? And that especially in terms of building buy-in from leadership and clinical teams who might be new to the work.
I can hop in on this one because certainly a lot of our national expansion comes to mind as we do work with healthcare sites all across the country. So I mentioned earlier how our program works very closely with child life specialists. So they're really our like primary contact at the healthcare facilities that we're in. So again, Child Life, they really support our music specialists on the ground. They help with facilitating getting into the rooms, Ricky, to your point. They're just very big advocates for the program. So with that, Child Life, it's really kind of a small community of professionals and they all seem to know each other across the country. So we tend to get a lot of referrals through word of mouth from child life specialists who might be working at one healthcare site with our JoyRx music program, but maybe they did their practicum or internship at a different pediatric healthcare site, and they'll make, you know, an introduction or a connection for us with hospital leadership there. So it's really helpful to have that strong foundation of relationships with these healthcare professionals because again, they really help to support and advocate for the program. So that has been a really successful strategy for us is just having that connection to build new relationships. But then I think that once the introduction is made, our program data is very important. So kind of some of those impact assessment results that I was speaking about earlier, because then it really helps to highlight the benefits of the music program. So especially when we're working with higher hospital senior leadership, being able to really speak to the benefits of the music program, the impact assessment data, our quality assessment model that we use for training our music specialists, I think really help to give partners trust in the quality and professional delivery of the program. So there's like the relationship side piece of things. And then there's also like the proven data and impact is just so helpful for stewarding relationships in the healthcare setting.
You want to add anything, Jenny? Oh, Ricky, bring it.
I was going to say, just from what I can see in our hospital biome, having multiple touch points and multiple artists who can fulfill different types of discipline requests. A good example is, you know, anytime we can get a public table art making station out for nurses and patients alike to be able to participate at. It could be on a holiday or it could be something like that. Any excuse to get out there is like that's a light touch point, right? And then you go into this like kind of like wheel within a wheel into like these deep moments at the bedside, which is kind of where I find my work happening the most. And then you have other things like offering, we offered a sickle cell songwriting group out in the community. And that was based on the desire that we saw for people to get creative about this really difficult disease that happens. And people are in here in-house multiple times a month. And we have these hospital touch points. We want to support their life outside the hospital because we know they're in and out. So these inpatient, outpatient, public community offerings, in-house, inpatient offerings, I think it helps to have multiple things that can attract different people at different interest levels as well.
Thanks, Ricky. Yeah, and to build on that, project that Ricky is mentioning yielded an album called A Warrior's Path that I highly recommend. And it's a great example because it also highlights the relationships we have with other healthcare workers in allied health professions. In that case, one of our chaplains, who's a staunch advocate for the patient population, joined and was able to lay down a track on that album and participate and bring her advocacy to bear. And then we kind of, firmed up a relationship, a longstanding relationship with ups and downs, as our relationships are within the institution. So I think that's a great example, Ricky. I'm glad you brought it. Another interesting partnership I think that we sometimes don't talk about for us is with our facilities department. So we are currently undertaking a new build, which is an art and recording studio space that we're calling Pollinator Studios. And without our facilities team, there is no way we would be able to shepherd the donor's gift for Pollinator Studios at the level that we would love to. And we've been guided every step of the way. We are also just about to install a legacy sculpture this coming year that was a really exciting initiative following many years of what we called the healing ceiling tiles that were painted by patients and families. And at some point we recognized that the ceiling tiles really don't hold up, that it's kind of difficult to get the quality of artistry that you may want. And eventually there are only so many tiles in the space. We were trying to think how else we might engage patients in a legacy project, and the sculpture came to be. Again, we're relying heavily on facilities to help us find a site that makes sense, design aesthetically in a way that makes sense, and engage our artists in that process. So that's an example of a partner you don't always think of. And I guess when I think across institutions of any scale or size, there's almost no department that might not have some way of benefiting from artists as partners, even as thought partners. When I think about our communications team, they rely on us to tell a really beautiful story, be it about patients or a healthcare worker who, has had a long-standing career here in the institution. We work closely with development and our donor cultivation team. We work closely with grant writing teams around our institution as well. We are, as artists, the storytellers within our institution. We have gorgeous stories and anecdotes from the space. Even with difficult health outcomes, we can tell a really beautiful story about deeply meaningful engagement. So I really encourage you to think deep and wide about the potential for partnerships all around the institutions where you might be approaching to launch or seed an initiative.
I love that. And I remember when the heart wall was being installed in Gainesville, which was an initiative, a community arts and health initiative that UF Health Shands brought to the community. The facilities folks volunteered to help install that. That's like how close the relationship is. They took time on their precious weekend to help get that thing installed well with their expertise.
I'm glad you said it, Natalie. And another thing's coming to mind, and Kate Burke, I see your question in the Q&A, and I think we're kind of talking around your question around how to get conversations started with busy healthcare professionals. I think it's really important to be deferent to the kinds of things that need to get done around a healthcare setting, and to be respite as best you can be, but certainly to be respectful, if not respite, for the treatment plan that needs to be undertaken, the conversations that need to be had between healthcare providers and patients and their families. That's the priority for the time being spent in a healthcare institution. So for us, I think it's been a long-standing relationship and partnership that really respects the healthcare procedures that are happening around us, and that where patients step out of a room and give space and lead for those healthcare providers to do what they need to do, and then they become partners for us. They see us as partners who respect their work, support their work, and want them to have a better work experience. So I think it is an opportunity to respect how busy they are, stay kind of out of the way. And I know that probably doesn't sound quite the way I want it to, but to be, I guess, in the flow, get to know the flow on a given unit and be sure that you're in the flow and respectful of it, and that you're actually able to go to that patient who might be on the call light all day, but only needs an activity and help them stay off the call lights so nurses or healthcare providers can reallocate their time for a little while. Those kinds of acts of respite make such a difference for healthcare providers and go a long way in building those partnerships.
Amazing. Thank you. I'm going to move us in. How has this much time gone by already? I want to leave a little time for Q&A, so I'm going to move us to another question. And this is really around career paths. Like, what does what does an entry point look like? What are the different career paths available? What skills are valuable for an artist, maybe a working artist that wants to transition into this space? Any insights you can share, and you can pull from your own practice or what you've observed.
I'm going to do a low-hanging fruit moment and get out of the way. But obviously, the UF Center for Arts and Medicine has a beautiful MA program in arts and medicine and 2 graduate certificates. We also have a research primer coming up January 26 to 29. So if you are newer to scholarship or research or even program evaluation, that may be a really good program for you to join. And then annually, we have an arts and health intensive that allows you to come shadow the artist at the hospital as well. So when I'm thinking about skills, sometimes it's noticing the skills you already have and any gaps that you may be trying to fill, and see which of these programs might help you to fill those.
Yeah, I'd love to piggyback on that, just because as a graduate of the UF Center for Arts and Medicine master's program, I actually did that program well into my career, and I found it so beneficial. So it wasn't something I did before I was starting. I came to it actually during the pandemic, because it, just seemed like a good time to go back to school. But it was such a wonderful way to sort of deepen my knowledge in the field, which just helped me to expand and grow so many skills. So some of the examples that Jenny shared, I had never really touched into grant writing before, or, creating a needs assessment for starting a new program, like really developing some tools for program design and development was so helpful for me. So even though I'm not creating my own program, they were such transferable skills to help build what I was already doing, and just really learning so much from the evidence base that's out there. Like I became very interested in research and understanding sort of what's already been done in the field, was incredibly helpful for sort of my professional development. And then I'll also just, again, speak to the nonprofit side of things. So of course, if this is something that you're interested in getting into, maybe you're just kind of wondering where to start. I know that we have some different examples here, representation from different types of places, whether academic institutions or directly at healthcare facilities that have embedded arts and medicine programs in them already. Of course, depending on where you're located, that may not always be the case or what you have access to. So I think there are so many incredible nonprofits out there just doing really amazing work, both in the community and clinical space for arts and health. So I was really lucky to find my way into the field through Children's Cancer Association and the JoyRx music program. But since then, I've just found it really amazing getting involved with other nonprofits, even in a volunteer capacity. So Swan Songs Portland, which is a nonprofit that provides free concerts for people at end of life. I became a board member 2 years ago to really just deepen my knowledge as well. And then getting more involved with NOAA, the National Organization for Arts and Health, where I co-chair one of the committees, is just an amazing way to build skills, build professional development, and network. I've just met so many people through these programs and different things. So just really encourage people to look into those avenues as well.
And I'll just add on to that something that in my everyday work is so important, and that is my relationship and communication with our admin team. Admin for arts and health is, they're rock stars at what they do, organizationally, communication wise with the larger institution. And I was just having a conversation with our research evaluator this morning, and it was such a beautiful conversation. We were having such a creative, artistic bent of a conversation, and she's going in to like just do all this research and data, and she's excited about it because it is the arts. There is such an art to that, and there's an art to being the go-between between the smiling face holding the guitar in the lobby and the person talking to the powers that be in the institutions. It's amazing what they do. So those opportunities are available as well.
And I just want to piggyback for a second on both Ricky and Elke's responses, which is that even on our administrative team, we maintain creative practice as administrators, and we really strive for our entire team to be artists at the core and to keep their artist identity central in their administrative work and in the practitioner work.
Amazing. All right, let's see. Okay, looking ahead, where do you see like emerging opportunities happening in arts and health that practitioners or artists could get into in the healthcare landscape and beyond?
I can chime in first. I was very excited about this question. It's a little bit based on the conversation I had with Cassie Belton this morning. We were talking about just the way that the work of arts and health, if you really pay attention, if you really look into it, it is the dream situation of excitement to organize something, excitement to reach people, excitement to meet people, excitement to influence how someone's journey through the healthcare system really goes and how they can gain some agency in making it giving it more meaning than maybe they would have been able to give it without those materials that we can offer them, those insights we can offer them. So something that I do see is other creative institutions, arts institutions, whether it be fine art or any kind of community building efforts, they can partner with us and we can fill that arts and health shaped hole happening out there, because I think that really does exist. I think there's like a little bit of a puzzle piece in other organizations that they could really benefit from having us along for their ride and us and you know them along for our ride too. And I think the more we see those tentacles of the way we work and the way we adapt, because we can do that really well. It's part of our job description. We can see more partnerships happening and the work of arts and health happening outside the clinical setting and inside far more easily than we can do it on our own.
Yeah, and I'd love to just jump in on this one too, because I also have a link that I'd love to share. So I think it'll get put in the chat, but I'm just excited to share that NOAA, the National Organization for Arts and Health, has been doing a lot of work around artist workforce development. And that's one of the committees that I've been co-chairing for the past couple of years. And it's been a very hot topic in the field too, for just advancing practice in the field of arts and health and professional development and what those career pathways look like. So we recently published a position paper called Advancing Practice in the Field of Arts and Health. We sort of debuted it at the recent NOAA conference, so happy to drop that link for everyone. But it's really just focused on finding more of those career pathways, foundational documents like scope of practice in the field, training and professional development resources and opportunities for artists who are either already in the field or would like to be in the field. And that's for both artists working in healthcare and community settings. So definitely encourage people to check out that new paper.
And I said it in the chat, but Elke, I just have to thank you so much for your massive professional contribution in this space. Really, really well done. And thank you. Thank you for the time.
Thank you. It has been, I will just say, shout out to anyone. There's probably people in this webinar right now who had a hand in it as well, too. It was just such a collaborative effort. We had so many people from so many disciplines, artists, administrators, healthcare setting, community setting, public health, different modalities of art, healthcare professionals. And those are just some of the people who were contributing authors, but then just the readers and reviewers, and just like so many people touched this paper along the way. And it really is, it's so collaborative because, you know, everyone is invested in the field. So yeah, thank you so much, Jenny. Appreciate it.
All right, we're down to 10 minutes left. So one quick question, and then we'll open it up to answer some of those questions in the Q&A. So what advice would you give someone looking to launch into this field or scale an arts and health program in their own community setting or clinical setting?
I'll dive in. What Elke's done with NOAA is a fantastic step to get involved at the field level with, a task force like they have been with artist workforce development, because I think you get a chance to network with people who are working across programs, some of whom are institutionally affiliated, some who aren't, some in the nonprofit sector. All kinds of sectors are represented there. So I just think we've come out of a very exciting convening season this fall, mostly taking place in New York City. Also, if you aren't following Jameel Arts and Health Lab's activations in cities, just know that Jameel is open to housing, hosting, healing arts activations in places kind of all around the world. And for one, at this time, those meetings are free of charge. So if they happen someplace near you, I strongly encourage you to show up, because regionally, arts and health programs, practices, initiatives, and events are kind of popping up, getting together, and mapping to one another in really, really exciting ways. There are a handful of white papers coming out about those. So even if it's not geographically close to you, or it's not financially possible to get to one of those, you can take a peek and see how a region did that kind of mapping exercise. And that is an excellent start for you in your own region as a model.
I would just say, look at people around you that are interested in the same thing, and figure out how to uh, yeah, galvanize with resources and ideas, and yeah, first idea, best idea sometimes, and all that.
Great. All right. Thank you so much for this. So much to mull over and consider. But let's look at, we'll start with Lisa's question. Arts and the clinical space both have their own systems of hierarchy embedded. As we work at the intersection and develop new models, how can we ensure exclusionary practice and elitism are left behind? Do you guys have any insight there of how you've managed this sometimes tricky relationship?
I mean, I can dive in just really briefly, because I know we have a lot of questions and I want to get to as many of them as we can, and say, I think it was pretty exciting to move from a 1099 to W-2 model. I think the more we can pay artists to be doing the work, I'm not sure how I feel about professionalization. I know it's something that we have cared deeply about, or even formalization or standardization, because it is so important that artists bring their signature to their practice and that they're working in locally contextualized ways that sometimes standardization can get in the way of. So it's a little bit of a rub for me. But I do think it's really, really helpful to think just a little bit about these kinds of concepts as you're moving away from exclusionary practice. And also the point earlier about any department being potential partner all the way across your institution, so that you're not just thinking you have to go directly to a CEO's office and sell a concept. And just to reinforce Ricky's concept, first idea, best idea, acting and staying in your agency, trying something and being willing to make mistakes, seeing us all as your community in this field, I think can be really valuable as well.
One thing that in my everyday practice, but certainly in our larger ethos as a program, is to be a patient-led organization, patient-led art. So that just requires, I think, a big skill in this field is listening and observing, and not necessarily performing or acting first, but trying to figure out, art is so subjective, creativity is so subjective, figuring out what your patient population considers art, each individual person, and adapt to whatever that is. And that is what stops like the barrier to entry into the arts practices for a patient. It should really be the same for an artist as well. We should kind of be thinking about patient first, community first, and then adapting to whatever that is.
Great. All right, we've gotten a few questions about how to convey the value of the arts to folks that haven't that in the healthcare system, healthcare workers that don't see it yet? Like, do you have any pointers?
One small thing is we have just released a series of papers in the Lancet in Nature Medicine. And I mentioned earlier the great research coming out of the Center for Arts and Medicine's Research Lab and UCL through EpiArts. There is more really strong scientific and compelling evidence than ever before in this field. We no longer have to find side doors and back doors. There is a really, really formal front door, especially in healthcare and medicine. So lean on that evidence base. And then my second suggestion is lean on your relationships. Make relationships and lean on those relationships. If you know anyone working in a clinical setting, your aunt, a cousin, a neighbor, start there. Start there and figure out what's the mission of that healthcare institution. What are the challenges they're facing right now? How might the arts help address those?
Any other pointers, insights, advice?
No, I think that was really great, Jenny. I think that was a great example. I'm curious, Natalie, too, just also even for a follow-up, maybe other people might be wondering the same as well, but I'm just seeing so many amazing questions in the Q&A. I know we're running short on time. Is there a way to do sort of like a follow-up to some of these questions that we may not get to answer live?
Absolutely.
Okay, great.
I
Okay,
think
wonderful.
that
I was like
I can send these out, let y'all answer them and share them with the group. Answer them
amazing.
in your own way.
Because yeah, thank you for putting all
Alright.
these amazing questions into the Q&A and the chat. Like these are
Yes.
just amazing. I'm like, we could just, branch off on a whole other webinar on just
Absolutely.
these questions alone.
Truly. This has been an incredible, we've got 2 minutes left, so I'm gonna wrap it up. Thank you to the panelists for bringing your insights and wisdom and experience, expertise to this conversation. I have learned some. I know that folks on the call have learned some. I will be sending all of the resources mentioned into and research and opportunities in the follow-up email, as well as the recording. We'll get those unanswered questions answered. And that's it. I think that we have got insights, discovered the role that arts and health can play possibly for you, an entry point into this arts and health world. Again, thank you to the panelists. Thank you all for coming. What else am I missing? If you aren't following our newsletter, we'll be doing, the series will continue in 2026. So the newsletter will give you the opportunity to register for those things. Also LinkedIn and Instagram. Thank you again for joining. Really appreciate having all of you on. This has been an incredible discussion and we will keep it coming. Keep an eye out for the next webinar. Thanks, y'all.
Thank you, Natalie, for beautiful moderating. Thank you to the center for inviting us. Take care,
And
everybody.
a shout out to Andres for all the links coming strong in the chat.
Yeah. Thank you so much, everyone. This was such an honor to be a part of, and it's Jenny, Ricky, Natalie, Andres, Farrell. So amazing to see you all, and so many names I recognize in the chat too. So thank you so much for being here.
Thanks, everyone. Have a wonderful afternoon. Keep it kind. Keep it classy.